And we all do know, just over the last 12 hours, the presidency came out with a release indicating that there have been some changes in the Ministry of Health ministerial portfolio. So a deputy minister of health has been moved to the Ministry of Communications, and he has been replaced by the Member of Parliament for Lejokuku, Dr. Bernard Okoboy, who we all do know is a trained medical doctor, as a practitioner. But also this has had many commentators, if not followers of the industry or the sector, having some reaction to it. But we also decided to find out how that also is influencing opinion among the health and service providers sector. Well, so we do have the national chairman for the Coalition of NGOs in Health, Dr. Gabriel Benaku, on the line. Good morning to you, Dr. Benaku. Good morning to you, Dr. Benaku.
Great. We are doing well.
Now, we know this news just came in the last the last 12 hours. For you operating in health, working with NGOs, etc., what does it tell you?
Yeah, thank you. I think that we've been talking about the issues at the health sector, taking into recognition that we do not have a specialized person leading the health sector. And so we are happy to have heard that Dr. Onobu Okuboy is nominated to be vetted to support the Ministry of Health. We know Okuboy as an advocate in the health sector, and we rely on him to support his minister to bring some innovations and some changes in the health sector. And we are looking for three major things. One, how the Ministry of Health can use technology to promote universal access to healthcare in Ghana. Two, how we can promote social medicine. If you notice this coronavirus issue, our survey reveals that 97% of Ghanaians are depressed. They are feeling anxiety and therefore they are sick. We will need much more effort in the sector to be able to provide social medicine to largely Ghanaians. And the other thing we want to see from him is to bring everybody in the health sector to work with the other interministerial agencies that have something to do with health, environment, agriculture. We need to promote One Health in this country. And these are the three critical issues. If we are able to do it, we will be able to reduce infectious rate in this country. We'll be able to provide the clinical service effectively because we are using technology, and we'll be able to bring everybody on board to contribute to the health sector. And so we are happy to have heard of the news. We pray for him, we wish him well, and we plead with the select committee to immediately do what is expected of them so that we can have an added value to the Ministry of Health.
And by way of observation, what are some of the pointers you've picked up so far in relation to how government and its interministerial committee and the committee of experts have managed the pandemic so far?
Yeah, our observation has been that we still don't have an integrated team in Ghana when we are managing the response. Let me give you a typical example. Over the last 3 months, we have not utilized the services of the mental health authority, and for that matter, psychologists, psychiatrists, and mental health officers. But we have seen the Ministry of Information progressively adding on, which is a good feedback they receive, and they are working at it. We want to see that in all the regions. We also want to see that eminent people in Ghana are speaking local languages. They are well informed about coronavirus, and they are speaking to inspire their people in the various regions. So it will reduce the stigma, anxiety, and the depressional conditions that Ghanaians are going through. The other point is that you will need the association of social workers and NGOs. Can you imagine all this happening? The NGO have played critical role, but the NGO have no any committee set up. But at the regional level, we are doing very well. So these are critical issues that once the president have declared, everybody must come on board, and these are not normal times. We are doing our bit, and we think all people who have contributed all this file should be acknowledged and should be brought on board to provide other services that the Ministry of Health Information cannot really.
What exactly do you mean by that, sir?
You have seen a test case in the policy and other markets where the Ministry of Gender and Social Protection tried to do item. Do they really understand the social structure of Accra, Kumasi? How many KIA do we have in this area? NGOs have experience in that. The Department of Social Welfare and Community Development have experience in that because they are working on the LEAD program. Why are they not involving them? They should have been part of the table discussion and they should have given the opportunity to do the direct implementation.
Well, we'll see about that. Now we have a case count of some 280 counting, 287 as it is. If you look at the trend in the cases in the other countries and then what we're having now, you say that it's a better managed situation, wouldn't you say?
Yeah, it is normal to have such a situation because we allow the vertical infection to grow in the horizontal infection, or if you like, community infection, and therefore you are expected to see this. I'm not a virologist, but as a sociological specialist, I think that social medicine will tell you that community reinfection and community social relations can really create infection faster than the normal infection, and this is expected to happen. But what we need to do now is to decentralize our response, and there are two critical things we need to do. We are taking this opportunity to continue to suggest to the president that we should progressively lock down the other regions and be able to manage restrictions in the area and protect more Ghanaians. And we should be able to pull out our scientific evidence. So far, what are the issues the clinical clinicians have identified? What are the issues the sociologists have identified? What are the issues the psychologists have complemented based on survey and research? And how can we learn from this and package information in local context? We cannot speak English in the northern region, but we have largely people who are illiterate. But if we begin to see, for example, Yana speaking local language to his own people, the people will associate and will take more impact in managing their attitude and the practices to prevent the spread. We cannot speak the same English in the northern, in the upper west and upper west. You need to speak Wala and Brunei so that eminent people can begin to do that and we can be able to manage this situation.
Okay.
We have to ask our who are well recovered now. Will any of them want to be an ambassador as a recovered patient from coronavirus? And can we take videos and messages from them? Can they inspire Ghanaians to reduce the stigma and the psychological trauma we are going through? And can they become the advocates in this country? Ghana is a unique country. We are loving people. And if we integrate these strategies into what already exists, we should be able to eliminate this virus in due time.
Thank you very much. Dr. Gabriel Benaku is the chair for the Coalition of NGOs in Health. And that's where we bring you the latest wrap-up in the world of entertainment on AM Showbiz. Do stay with us.